Everyone. I'm Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Central Florida on new moon, new patients, and new quantum level 2. So, new moon, new patients in the new quantum nutrition testing level 2 class. Let me know if you're on. Let me know if you can hear me, and we'll get this party started. So tonight is a new moon. Why is that significant? What is up with moons? What is up with new moons? What is up with full moons? I didn't really care about moons. I just, moons were not a thing. Moons did not matter to me. But moons are important in that they can have an effect on what parasites do. So parasites are little creatures that live in the body, and they can wreak havoc. So I was just teaching in the Quantum Nutrition Academy, and I was telling them about a case of this little boy. And this little boy was aggressive. He would hit his mom, he would punch his mom, he would bite his mom. And when I first met the little boy, I thought that he was just out of control. I thought he was this little kid who was mean. He was mean, he was out of control. And if looking at it from a parenting standpoint, I just thought the parents were just bad parents, right? Just to be honest, I thought the parents were bad parents. The kid was out of control. It was bad news. So we did quantum nutrition testing on the kid, and the kid is 5 years old. And quantum nutrition testing is specific to our office at Palmer Natural Health. And what it does is it allows us to determine the cause of the problem. It allows us to look for what potentially could be causing symptoms. And so let me know if you can see me on Facebook. I think Facebook is banning me. So yeah, that's a thing. Shadow banning is a real thing. It seems to happen on anybody who wants to tell the truth about what's happening in society. And so I'm going to keep moving forward anyways. And so I felt bad for the mom, and I felt bad for the dad, and I felt bad for the kid because this kid was aggressive and no one was having a good time. The kid was upset, the mom was upset, the dad was upset. And as we dug into the case, realized that this little kid had imbalances in his system. One of the balances that occurred was from parasites. And so parasites are super easy to get. Hi, Stephanie. Hi, Michelle. I'm glad my YouTube link is working on Mama Bear Live on YouTube, Dr. Mama Bear or Mama Bear Doc. And so parasites can eat the neurotransmitters in the brain, and it can make you feel anxious. It can make you feel depressed. It can make you aggressive. And so as we started helping this little boy with parasites, his behavior changed. His whole life changed. He no longer was aggressive towards his mom. He no longer was aggressive towards his dad. He started coming in smiling. I didn't even, the first, I don't know, couple months, I don't think I ever saw the kid smile. He was just always upset. And that's not who he is as a person, right? He's not just like this little mean kid. It was because the parasites that you can get from breathing them in, right? So they can be airborne. You can inhale them just by being outside. You can eat them. So you can find them on sushi, on meat that's undercooked. You can find it on vegetables. You can find it in vegetables, in fruit. You can walk on them. They can crawl in your butt. They can crawl in your feet. They can crawl up your urethra, so where urine comes out. You can get them from lakes, rivers, oceans, swimming pools. I mean, they're really, 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 really common. And outside the US, many countries will treat their children and their adults to a parasitic cleanse yearly, and in some cases, more than one time a year. I find it extremely interesting that other countries acknowledge the presence of parasites, but yet in America, it's often ignored. You give your dog, or you may give your dog one time a month heartworm. Well, what is a heartworm? A heartworm is a parasite that can come from fleas, right? You can get a dog can get a tapeworm. Well, why do they say you have to give your dog heartworm protection? So I am not a veterinarian. I'm a dog owner. I am a holistic physician. My degree is I'm a doctor of chiropractic, and I have decades of holistic nutrition where I've studied in depth on parasites and chemicals and heavy metal toxicities and food problems and allergies and you name it. I've spent more on holistic nutrition than I spent on my undergrad degree and my doctor of chiropractic degree. But I'm not a veterinarian, so I'm not advising you from a medical or veterinarian standpoint. But isn't it interesting that our veterinarians, right? So anybody ever play the game? Like if you were stranded on an island, who would you want with you? I would want a veterinarian with me. Why would I want a veterinarian? Well, veterinarians understand animals, and on the island there might be animals. They are very talented doctors, right? So not only do they have to understand the physiology of all the systems, they can't just specialize in the heart. I guess they could, but oftentimes they're very good with the heart and digestion and this and this and this. But they're also surgeons, right? They know how to cut and sew, and they know how to handle broken bones. And so that's why veterinarian versus medical doctor, if I was stranded on an island and I had to pick a doctor, I would pick a veterinarian, which sounds crazy. I know it sounds crazy, but they're so well-rounded physicians. And so a lot of veterinarians will recommend that you, if not all of them, will recommend that you give your dog one time a month heartworm. What is heartworm medication? What is a heartworm? It's a parasite. What type of parasite? It could be a tapeworm. Why does it like to go in the dog's heart? What does it do to a dog if it gets in the dog's heart? Well, if the infestation of parasites is really bad, it'll kill them. And so heartworm medication can be made out of an antiparasitic drug called ivermectin. Okay, so you guys heard of ivermectin during the pandemic because ivermectin is an antiparasitic that had some beneficial properties for the pandemic. So, what is the point of this? In new moons, parasitic activity gets more active. During full moons, parasitic activity gets more active, which can cause, let's start at the top, can cause migraines, seizures, headaches, cysts or lesions in the brain can be parasitic, floaters in the eyes, grinding the teeth, can get into the thyroid and cause autoimmune thyroid, Hashimoto's thyroid, can get into the lung and cause lesions in the lung, can get into the heart and maybe block arteries, causing myocardial infarction or a heart attack, can get into other blood vessels into the brain and cause stroke. Definitely go into the digestive tract, right? Some of them have teeth and they get into your digestive tract and they soak up all your nutrients. Can cause abdominal cramping, stomach pain, bloating, nausea, vomiting, diarrhea, constipation, ulcerative colitis, irritable bowel syndrome. Can get into the uterus and cause problems with fertility, can get into the testicles and cause masses in the testicles, can get into the uterus and cause fibroids, can get in the anus, can cause fistulas, like fistulas. It's just, they can go wherever they want. These are nasty, nasty creatures. And for whatever reason, unless the medical doctor is a neglected tropical disease doc, it's pretty much ignored in the US. If you talk to an Indian medical doctor, they are very aware of parasites. If you talk to an African medical doctor, they're very aware of parasites. If you talk to some Latin American physicians, they're very aware of parasites. But for whatever reason, maybe because American physicians work very closely with pharmaceutical companies, and a lot of antiparasitics are very inexpensive. Maybe that's why they're really not trained in that very much. Stephanie says, I swear I've seen them in my eyelids when I close my eyes. Yeah, you can see that. And so new moons stir up bugs. And when bugs are stirred up, you can have symptoms. And they may make you have sugar cravings. Like you might be wanting to watch this live and eat cookies or brownies or whatever, ice cream, whatever, right? And so some new patients are coming in this week with anxiety, with bloating, with headaches, with lesions in the brain, with a lot of the symptoms I just talked about. And so unfortunately, some of these patients come to us and we are their last hope. I don't want to be somebody's last hope. That's a lot of pressure. And really, we're not curing, we're not treating, we're not diagnosing. All we're doing is looking for imbalances in the body using a technology called quantum nutrition testing and looking for special herbs and homeopathy and whole food supplementation, carbon technology to rebalance the body, to get the body to do what it was meant to do. The body was created to heal. If you cut yourself, you're cutting up your dinner and you cut yourself by accident, you don't have to tell your body to heal your arm. You don't have to say, okay, heal my arm. Okay, grow skin. Okay, clot the blood. Okay, handle the bacteria. You don't have to say that. That'd be weird. Your body has its own intelligence on how to heal. And unfortunately, oftentimes it's bypassed by different communities and it's suppressed, right? So a medication has side effects, whether it's over the counter or a prescription drug, always, always, always has a side effect. Why does it always have a side effect? Because it has chemicals and metals in it, right? And so some of you know that I developed quantum nutrition testing to help my father. I developed it out of need to help him while he was hospitalized during the pandemic when there was no visitation. And it was a blessing and a curse. So the curse part was that he had a stroke, right? So was it a parasite that my father consumed sushi every single week? It was like their Friday night thing every single week for decades. Um, so it was a blessing and a curse. It was a curse because he had a stroke and that's how he ended up being hospitalized. It was a blessing because when he was hospitalized, we couldn't visit him. And I figured out how to test him from a distance. And that's what we call quantum nutrition testing and look for the cause of his problems. What came out of that is teaching other practitioners, other really cool people how to quantum nutrition test, which has developed into an online course, what we call quantum nutrition testing level 1, which is online. You go to qntacademy.com and also has a live course. So teaching it how to do that live. To me, in person is awesome. So I have a lot of students, they'll start online and then join us for a live class. And then I realized very quickly that I could not pass on all of this data and knowledge and information I've gathered from almost 2 years and 2 decades in practice. And so created level 2. Level 2 is being launched this weekend. So exciting. We have students coming from Alaska, California, New York, Indiana, Arizona. Where else? We have students from Guam. We have more students that want to come from international. So it's really, really cool. We have guest speakers. And so we're going to be talking about why cases get worse. If a case is getting worse, how do you test deeper to figure out the cause of what's happening? We have a very special doc coming from way of South Africa. So he's South African and specializes in fertility. And so he's going to give us in-depth knowledge on female physiology, male physiology, when female physiology goes wrong and produces symptoms like cysts and fibroids and polycystic ovarian syndrome, infertility, PMS, menopausal symptoms. For guys that have low testosterone or having issues with fertility as well, why does male physiology go wrong and how do you handle that naturally? So that's Dr. Colin LaGrange coming. He's originally from South Africa, has a cool South African accent. and is coming from the Northeast to do a special seminar for us in level 2 on fertility. We have Brad Bates, who is going to be teaching us on advanced procedures using the Energetics product line, which is a homeopathic line. Also has some really awesome herbs in it. It's a liquid line, and they have some capsules. So we're looking forward to that, coming from Colorado. We have Jimmy Scringy coming from New York, teaching us on vaccines and vaccine damage and how to protect our future generations from potential issues. We have no other than my husband, Dr. Jason Dean, speaking on recession proofing your practice and purpose. And it's going to be amazing and inspiring and awesome. And then I'm filling in the gaps on the deeper testing and more efficient testing and effective testing and more clinical gems. And it's going to be action packed. There's so much content. I've been writing it basically since I released level 1. I've been writing level 2, full of awesome content. That content will be delivered in a live format, which is what's happening this weekend. It's going to be recorded this weekend and popped up on the Level 2 Academy. And so those of you that can't make it to Florida this weekend, in a couple months after that video goes to editing and we get it up in the course, that'll be available. And then of course, level 2 will have its live dates as well next year. So all that will be released really, really soon. The website for that is www.QNT, so Quantum Nutrition Testing, QNTacademy.com. So I'm super excited. Those of you that are traveling from out of state, I wish you safe travels. Those of you traveling in state, I wish you safe travels as well. I look forward to seeing everyone on Friday and Saturday. It's going to be epic. And I just can't wait. I can't wait. Usually the night before a big launch like this, I can't sleep. So hopefully I get some sleep, but I'm so excited. So thank you for joining me. I'm Dr. Lisa Palmer, Dr. Mama Bear on new moons. And so if this new moon is making you anxious, making your stomach hurt, contact us. We can help you. On new patients, happy to help people locally in Florida, happy to help friends and new friends out of state with their any kind of concerns that they have, and then totally excited for my practitioner family to join me once again for level 2 in sunny Florida. I'm Dr. Lisa Palmer, Dr. Mama Bear. Good night, everyone. Bye.